So I'd like to introduce now Niall Muldoon, who's our Ombudsman for Children, and Niall's going to talk about his office's work on child and adolescent mental health and the school community teams as well.
Thanks very much, Anya. And thank you, Sarah. I'm now going to go home and check out whether it's my wife has passed on the fear of spiders that I couldn't fix, or I was trying to fix it in the wrong way. Be a man, be a man. Pick up those spiders. The fact that there were two girls it didn't help. But they're 21 and 18, they still want me to pick up the spiders, so I've failed somewhere along the line. Anyway, thanks a million, Anya, for the invitation, to INTO and yourselves, the MPC, for setting this up, and a hugely important event today. And thank you all for attending and for sticking around. I've learned an awful lot today. Okay, get the right. These ones here, yeah. Okay. Let's just start off a little bit about me. I used to be cute, but as you can see from the top of the hair, I was never a hairdresser. I went at the fringe once on my own, and that was the last time I was ever allowed to touch it. I always try and show that picture because we had an event in 2017 in which was led by children in Croke Park, 300 kids or 300 people, and they said nobody was allowed to present unless they showed themselves as children. So I think it's a great way to remind me of why I'm doing this work and who my audience are. A little bit about me. Many years ago I worked in the bank, as I keep saying to my kids, in the other century, the previous century. Found that I loved working with people, not so good with the figures, I'm afraid. Targets, sales, that sort of stuff. So I moved out, went to England and got a degree in psychology. Came back and spent 15 years working in the area of sexual abuse and child protection as a psychologist. Moved to work with CARI, which is a child protection agency, or sort of therapeutic services for children and families affected by abuse. We had services in Limerick, Cork and Dublin. And then I got a job as Director of Investigations in the Ombudsman for Children's Office, which would be sort of number 2 to the Ombudsman, Emily Logan, who was there at that stage. And since 2015, I've been Ombudsman for Children. The Ombudsman for Children's Office is a statutory independent body, which essentially means that I get a 6-year term. My first 6-year term finished last year, and I was very honoured and humbled to be given a second one. My contract is signed by the President. He's the only one who can sack me, thankfully. I haven't heard from him in years. That's a good sign. So it means that my job is to be a pain in the side of the government, to push public services as far as they will go to try and promote and protect children's rights, to make sure they do everything as well as possible. I got a 6-year term and I've got a second 6-year term, but that's it. I'm not going to get cosy. It will not be my long-term pensionable job. So the idea is to keep pushing to make the services better all the time. So who oversees me if I'm independent and statutory? I don't report to the Taoiseach, I don't report to the government, I don't report to the Minister, the Secretary General or any department. So I go in directly to the Oireachtas. So when you hear of an Oireachtas committee asking people about the work they do, in this year alone, we're just coming into sort of the middle of the year, I'll have gone to 5 different Oireachtas committees already, and there's another one next week, on issues. The Oireachtas committee I've been in, I can go to Committee on Education, Committee on Children, Committee on Health, Committee on Housing. I've been in committee in relation to travellers, in relation to mental health. So anywhere, because again, the whole idea is that children cross all these bodies. They don't grow in straight lines. Okay, I'm in health today, I'm in education tomorrow. And that's the accountability. So the accountability is across all parties can ask me any questions and challenge me. And it's a very transparent way of doing it. And it's a system that works. Again, as an office, we take complaints from anybody, child or parent or advocate for a child, where they are not happy with the service that's been provided by the government or public service. That could be schools, hospitals, housing, local authorities, anywhere where the government are paying for services. We can take a complaint. Once you've given them a chance locally to try and fix it and you're still not happy, you can come to us. And before we were in existence, you would have had to sue the state. So you'd have to get a barrister, a lawyer, go to the High Court. That's what would have happened with Cathy Sinnott way back. So we're free, independent and impartial. We're neither an advocate for the child nor an adversary to the public body while we're inquiring or looking at investigations. If we find after an investigation that this public body has done wrong and we want to make recommendations, then we will be the strongest possible advocate for that child and those issues. So that's the work we do. More especially in relation to mental health. Since I came into office, in 2015, we completed the strategic plan that was in place at that stage, and then 2016, I created a new strategic plan, 2019, and just last 3 weeks ago now, we created our current strategic plan, and each one of them, 2 issues stayed as strategic priorities: disability and mental health. I've also looked at issues like homelessness, direct provision, children of traveller and Roma background. But for this current one, we have disability, mental health, and the future of education. And again, I think the 2 are fitting very well today. You can see how the 2 can blend so well: the importance of education for children's mental health and the importance of children's mental health for education. So it's been a really strong platform that we've been pushing very, very hard. Now, I must say, I'm a bit disappointed to be able to say that I think mental health has gone backwards the last number of years. I don't think it's gone the way it should have. And there's a number of reasons for that. But again, it is disappointing to see that children's mental health has not shown any progress in the way that I would have liked to have seen it since 2015. Again, these are things you would have seen already, but these are just headlines that I picked out without too much effort. The most recent one, CAMHS waiting list grows by more than a quarter. That was back in May. 11,700 children and teenagers accessed mental health services last year. That was primary care elements. Up to the end of November 2022, 20% above the demand that the HSE expected for last year. That should have been end of 2021 for last year. So again, huge increases in mental health. And we heard a bit today about how much Coleman would have talked about that, the impact of the culture that we have, the impact of COVID, the impact of the different lives we're leading to maybe 15, 20 years ago on children. December 2020, the number of children waiting for psychological primary care services reached an all-time high of 10,500, with around half of those on a waiting list for more than a year. And again, having spent a lot of my time in the area of sexual abuse, we get very, very brave children coming forward, their parents coming forward to help them, to acknowledge that they're in trouble. And if we put them on a waiting list for a year, what happens is they find a way to live with that and they won't come back to you. Crisis is an opportunity. That's when the doors open. Okay, give me all the help I can get. If you leave me for 3 months, I'm going to find a way to cover up that wound a wee bit. And then you leave me for 6 months, that wound starts to feel like it's healing. And then 12 months later, I'm not going to tell my friends I'm going off to therapy because you've waited this long. And I'm going to, and I remember working with kids who for 6 months said they were going for physiotherapy because they were afraid to come into therapy because we'd left them so long. Because they'd gone from primary school, which wasn't as scary, but then you go to secondary school, you definitely don't want to stand out by going out every Wednesday. So again, waiting lists are a problem for us, and we need to find a way to help our children. And within that, again, to put into focus, and when I talk about feeling we haven't made progress, one of the key things of children's rights is that they have the right to the highest possible level of health services, and that includes mental health. Within the health budget, Stephen Donnelly's remit, 22 billion euros is spent. Again, just to remind you, that means 22,000 million is spent in health. At this moment in time, my understanding is that 1.2 billion is spent on mental health. That's approximately 5-6% possibly. Of that, the best I can get out of anybody is that there might be 200 million spent on children's mental health. That's a guesstimate. They deliberately do not tell us how much is spent on children because they say, oh, it's very hard to get the data because it's this hospital and that hospital, and some have adult patients and some have children's patients. If you're going to do children's rights properly and you're going to provide proper mental health services, you need to know how much you're spending on it. If they come to me and they ask me, how much have you spent on your staff, I'll be able to tell them, or else they won't give me money for my staff. I have to give them the right data back. They don't gather the right data. 200 million. And some of you might be smart enough to do this in your head, but I had to use a calculator. That works out at less than 1% of the overall health budget that we've got in Ireland. And that's gone up by 4 billion in the last 4 years, but it hasn't transferred to children's mental health. So Department of Health have a really big role to play in this, and I'll be saying a bit about that as well as we go through. For me, again, there's been an accumulation of evidence in the last number of years coming to, I hope, to fruition over the next couple of months, where we will find an increase in the budget in certain ways. Rosen and McIlvanney put work together, National Parents Council and St. Pat's were the ones who commissioned the report in 2017, where they asked principals in primary schools. So again, 3,000 very, very busy principals were asked to fill in a survey about mental health services that they needed and the services that they had to provide for the children that they were working with. Unbelievably, 1,300 still found the time to fill that in. That's how important it was to them. That's a huge return for a survey, an online survey that was sent out. 72% wanted individual therapy for the children in schools. 49% would provide group therapy. Again, it's this idea that they could see how it could work, because a lot of the principals had already seen the issues at hand, and I'll talk about some of the issues in a second. One of the figures that they came up with looking worldwide is to provide the services, and I'm not sure Sarah might have this figures yet, but they looked worldwide and they found that services provided in schools for primary school, for every pound saved, 620, or for every pound spent, 620 was saved. So let's say that's hugely wild. Let's just bring it down by 50%. Let's say €3 is saved. That is money well spent. Again, if you're only spending 200 million now, if you doubled it to 400 million, you're going to get back 800 million. Easy. It's a simple process. Following on top of that, I asked my staff to do work, and again, one of the things we all want to do is hear the voice of the children. In 2018, we did a report called Take My Hand, in which we went in and visited all the inpatient, 5 out of the 6 inpatient units in Ireland where children with adolescent mental health difficulties were staying. So there's 4 public ones and there's 2 private ones. We got into 5 of them. And again, we asked them about their journey through mental health. We didn't ask them about education, but they came up very clearly with this quote, that they wanted additional therapists to be available to alleviate the anxiety of having to wait long periods to see a suitable person in school. So they knew that waiting was adding to their anxiety. And they wanted young people with serious mental health issues should have regular appointments with school therapists every week. And they were also very clear that a lot of the therapists, guidance counsellors don't cut it, because they didn't understand the level of mental health issues. This, again, most of them would be sort of teenagers, so they're probably second level, but a lot of them would also have figured out that they could have done with the help earlier on. So that report was published, and our first publication went into the Oireachtas Committee on Children and went forward from there. I've been engaged with my colleagues and children's commissioners in Wales, Northern Ireland, Scotland, England, and they have all got services like this across the board. And it's, you know, we know Scotland last year made a commitment, or 2020 made a commitment to £80 million for over 4 years to start bringing the service into their schools. Again, you've heard very much from the Dorset mental health team, and I think your numbers, I've got 495 as the last time. It's gone up 690, yes. 690, 679 children. So again, let's take that back and say, right, there's 679 appointments available within CAMHS for the child who needs it. Huge savings, huge change in things, huge change in waiting lists. Takes the pressure off CAMHS, allows them to do their job better, takes the pressure off the teachers. Everybody wins. Phenomenal, brilliant pilot for us to look at and to try and bring in. The Oireachtas Committee on Education specifically took about a 2-month run, 3 months perhaps run at COVID, and created a report that provided for the recommendation that provide specialist emotional counselling and therapeutic supports on site in all primary and secondary schools. They also did a specific body of work recently, last year, in relation to school bullying and mental health, and provided the same recommendation. So this is a cross-party, non-biased, focusing on the children and education, twice making a recommendation to our government that we need to provide these specialist emotional services in school, in situ. And then we have the INTO coming in this year, rowing in and making it a priority issue, which is absolutely fantastic from my point of view, because that brings the primary school into play in a really big way, as opposed to us outside suggesting this might be a good idea. So for me, that's hugely important. And it also, for me, again, the INTO, we're talking about 11 million, you said, John, isn't that right? 11 million, hopefully that'll be the pre-budget submission. What I would do that, I'd say, right, 11 million from Department of Education and 11 million from Department of Health. Again, given their shortfall on what they're spending on children's mental health, Can we see what we could do with a pilot and that sort of level? And the money that would be returned to us, if we assume, again, £3 back for every one, that's 22 million spent, we're getting back 66 million. To me, we're at a situation where it's becoming close to a no-brainer. But again, let's be realistic. Let's hear it, and you've heard a lot of stuff from Sarah, what she's doing and the work they're working on. These issues that are up here are issues that came out from the principals in that survey in 2017. So these are real. These are things...
I think it was IPPN, not us.
IPPN, my apologies. Sorry, okay, thank you for correcting that. And even from the IPPN, I'll say it again.
I don't want to take it.
Yeah. But 2017 report, this is 1,300 principals, 1/3 of the whole population of schools, more than 1/3, have said these are the issues. So family separation, divorce, they were the biggest issue, about 80%. And again, you're looking at things like separation, rows, blended families, step families, just issues that are normal. Again, not pathologizing it, but can really hamper a child's progress. Anxiety comes out of that, and you've heard all about that from Sarah and how that can grow from all sorts of different angles. But once we help the child through it, that's where resilience comes. You help them through it, then they have a skill for life to overcome the anxiety that we all feel later on at different stages. Bullying and cyberbullying are issues. Self-harm, again, is an issue. And again, for me, it is scary to hear that we're thinking about self-harm at a primary school level. But we are, and the principals are saying it. Suicidal ideation, again, that's the more extreme side. But if it's there and they're seeing it, they have to deal with it. But they have no funding for it. They have no skills in it. But I'm sure much time would that take up if a child is with suicidal ideation. You've got to assume 2 or 3 teachers are consumed by that for at least a number of days. Whereas all they need to do is refer to someone and say, tell us how we can deal with this properly. And we'll all deal with it properly. Eating disorders are growing all the time. Again, we've been promised many number of eating disorder units around the country. There's supposed to be 4 in place by 2015. Never happened. Staffing isn't there yet. So we're behind. So 11 million from Department of Health would go a long way to helping these young people as well, to prevent that becoming a stuck issue. Depression, sexual identity. And again, sexual identity is an unusual one in primary school, I would suggest. But it's starting to get there. Again, we have an openness now, an openness about information, maybe not necessarily an understanding that comes with that openness, but there's a much more open forum around the world from the internet and various different things that have been discussed, and more openness on telly. There's no such thing as the watershed anymore, so you can't protect your child from some discussions. But it's real again, these are things that the principals have said, this is an issue for me. And if one principal out of 3,000 says it, we need to provide that principal support. So again, it's hugely important. The answer is professional therapy, like a big warm hug. Let's provide that children with that opportunity. And this is a quote, some of you will, I'm old enough now to remember this guy, some of you won't, but I'll name him anyway if you don't recognize the picture. Paul McGrath, unfortunately a troubled man with a background in alcoholism and various other issues, but I love his definition of therapy, being like a massage for the brain. Can you imagine what your child is like if she gets a massage or he gets a massage for their brain and they come home after that's looked after? Wow. Wouldn't that change the world? And that's all we're offering. We're offering an opportunity to take away the pain, uncertainty, nervousness, low self-esteem, opportunities to help the child grow in the best way possible, which in turn then allows them to focus on education, which brings back the dream into reality. You know, it brings back that opportunity for them to be the best they could possibly be. So even if they're homeless, or even if they've got COVID issues, they've got all sorts of issues going on, school then becomes more than just a place where they educate and have to pretend to be okay. It becomes a place in which it's okay to be myself, and even when I'm tired, scared, worried, depressed, thinking about self-harm, they will still hold me, and they will still provide me with that opportunity to be the best I can be. That's a huge change in the society. We can create that in our primary schools. That should be something every minister should be proud of saying that they've contributed to. They should be really beating the door down to the INTO or to the PSI, or whoever they want to bring in to make this happen. It should be an opportunity for the department to lead from the front and say, this is us really putting our money where our mouth is. We want to put our children first. And we're going to work with the children we already know have issues because the principals have told us. The facts are there, the data is there, and we have a real live possibility to transfer something from UK to here that can work in a very, very short space of time as well. So I really, really think it's a hugely important opportunity. And again, who benefits? The child, obviously. They get the massage for the brain. They're happy as Larry. Hopefully, you know, it's not always a fix, but it moves them in the right direction. It takes the pressure off them. Parents as well, obviously, they can feel much more relief, takes the distress, and they've got somebody helping them cope. They can talk about it. All those things are there. The teacher then is no longer the one carrying the burden. They've got an opportunity to breathe as well. Little Johnny's looked after. I'll see how he is when he comes back from the therapist, and we'll chat from it there. But it's not all on me. You know, I'm only 3 years qualified. Why am I really love this child, but I don't have the skills. The principal, again, you know, what did John say? You said maybe there might be 5 children in every classroom that has something that needs a bit of help with. That means the principal's probably carrying 50 of those, maybe. And he knows most of them are looked after in a professional manner. Then we're in a different space, and he can focus on other things that are going to bring the school up. The whole community benefits from this. There's no losers in this. There's no losers. The community, the school, the student, the family, everybody benefits from this because you have a child who is no longer distressed. And that's a win all the way around. And we've got to remember that. And so too does the government. Because again, the child who simply has an issue because their parents are separated and it's 8 years of age, who gets angry, who gets cross about it, and blames themselves, as was the wont for every child. Blames themselves. Parents are too busy fighting with each other, they don't get on, maybe there's a new partner. If they don't get help till they're 14, all of a sudden they're angry, they're retreated, they might be drinking, they may be acting out sexually, they could be depressed, they could have gone into themselves as well. So all sorts of things that happen, and it might take a lot longer to figure it out. And then they might also not blame it on the divorce or the separation. It might be something else, so the issues get muddled up, and that child becomes more troublesome, and the government have to handle that as well, and they go on a waiting list for CAMHS. So this is a win-win all the way around. I've looked at this from many different directions because trying to find a way that would be pragmatic and solution-focused. And I think we have it here. I think we now have a demand, we have a funding demand that looks real, and again, I would push hard that we get money from the Department of Health too, because don't let them off the hook. It's important that they acknowledge that and contribute to it in a way that recognises that will reduce the primary care bill. It'll take people off primary care psychology, take them off other waiting lists as well, and everybody benefits. And I think it's just about a transfer of fund in the right direction to early prevention. So I've probably gone through it relatively quickly, but I think the time is now. I don't think we can delay any longer. There's enough evidence there, there's enough backup, there's enough experts to help us provide some sort of a skill or contribution towards a pilot, so that we get a budget in place for 2023, we can have a pilot in place for September 2023 with proper professionals, a proper background, and something that can really run that would be transferred out very, very quickly. I look forward to seeing that happening, and I will be pushing very, very hard from it. Thank you very much.